Welcome to Spotlight Sioux Falls, where culture meets commerce and the people behind our favorite places get the mic.
We're your hosts, Melissa Goodwin and Steve Schmidt, and we're sitting down with the makers, doers, and dreamers shaping the soul of our city.
From storefronts to side hustles, tattoos to tech startups, we are telling the stories that make Sioux Falls shine.
Because behind every business is a human story, and those stories, they're what make our community feel like home. This is Spotlight Sioux Falls. Welcome to episode 2 of Spotlight Sioux Falls. Today we are here in the super cool Startup Sioux Falls offices. This is where you see all kinds of great art. There's all kinds of founders. They have classes here. This is a great place for any entrepreneur here in Sioux Falls who wants to get their start or maybe wants to get some mentorship. Today, we are going to be filming here with our friend Sandra Melstad. She is a PhD and Master's of Public Health, and she's going to be talking all about her company, SLM Consulting.
Welcome to episode 2 of Spotlight Sioux Falls. I'm one of your hosts, Steve Schmidt, and we are with Sandra Melstad down at Startup Sioux Falls. I want to talk about this. We gave you a wonderful intro, but we need to dig into what you do, how it affects public health, and how people can really start to disseminate some of this information. You're a doctor. You deal with data all day, and you help right here in the community. And I think the part that's most intriguing to us is that it's a community problem, and you're attempting to solve it through community. So welcome to Spotlight Sioux Falls.
Thank you. Thanks for having me.
And you guys, this is funny because she said, oh, what I do is so boring. What you do is so important and so not boring. And so let's dig right into it. I walk up to you at a cocktail party. What is it that you do?
Well, depending on who I'm talking to. So if we talk about it in just general layman's terms, we work on getting people healthy. So population health, prevention. We're here to help support community level health, whereas sometimes in the medical lens, we look at it from an individual lens. So in public health, we look at it from a population community-based lens. And so we're here to get people healthy, look at prevention of diseases from happening in the first place, and find ways to help everybody live healthy in their community.
Preventative care is huge. Communities even bigger. I think we've heard a lot of data that goes around isolation is a very bad idea in any stage of life. I think one of the things that I want to really dig into, the first questions is, when I think community, getting healthy sometimes can be told that it's your responsibility, not your doctors, not your neighbors, own your health. When you hear that in your role, what is your response? Whose role is it?
It's both. It's
Okay.
both. So to be really on the research side, you can look at, we have models, it's called socio-ecological model, but the idea is that health is impacted by all different levels. So when your interpersonal relationships, your individual, where you work at, your policies. And so what we know from the research and years of data that really when we're looking at improving our health outcomes, a lot of it really looks at things at the systemic level. So policies, structures that have been in place for years that make it harder for people to get healthy.
Right.
There is some level of personal accountability with individual behaviors, but we know the research overwhelmingly shows that most of those are driven by what we call the root causes, or things that really drive those things. And so, so it's not just as simple as get out and exercise and eat healthy.
I understand that. So I think, one example I can think of that maybe people can relate to is, I grew up a little bit, my mom went through a few years, right, in between where we didn't have a lot of money. And I remember going to get, one time, we went and got like the powdered milk and all that. And I felt really like at that point in time, maybe we were in that sector of the economy or the population that was eating things that were filled with bad things because that was what we could afford for a couple of years, and then we got it back together, right? To me, that felt as much as, looking back, like a responsibility of the choices as it was the availability. And I think that that's what I'm hearing a lot about, right? Well, the choices, like what is available to those people in maybe some of those more rural populations, urban populations in the center of town. What are they eating in school? What are they not getting at home? And I know for me, Melissa, my better half, knows a lot about this, so it's very interesting to me. I want to dig into that. I'm going to stop talking. Is it a problem that people need to put more ownership in, or do we as a community, not as a political organization, need to take more responsibility?
I would say it's the community, and that's coming from the public health lens. Again, there's some level of individual responsibility for things that we do, but we know if we can work at it from a population level, it makes it easier for people to have those choices. Right. So when we look at rural communities, okay, maybe you're not eating as healthy, but maybe there's not access to foods to make those healthy choices.
Right.
People don't have access to transportation, so how do you get to those places? And then we couple it with low income, low education, a lot of those other factors we know intersect with each other.
Yeah.
And so, so that's really where we know, again, there's a lot of data and years of research to back this up. So we know that that's where the kind of to get the most bang for your buck, you're going to see the most valuable in improving health outcomes.
So we got to ask the question, how did you get where you are today? What did you study, and when did it become apparent to you that this is what you want to do?
Yeah. So kind of, I think anybody's path is not linear. And so I went to undergraduate school for health promotion and knew
Go Jackrabbits.
Go Jacks. So I knew I wanted to go on to school beyond that. I didn't know for what. I think in undergrad I had a minor in public health. Maybe didn't really know too much about it. And then I thought I wanted to go into the Peace Corps. And so I applied to schools that you could also do the Peace Corps and get your Master's of Public Health, or we call it MPH. Applied, got in, so ended up going to school in Tulane in New Orleans. Was there graduated right before Katrina, but had a great experience there, studied in community health, had a great experience, just different culture. I knew I wanted to be part of something different. And then, when I finished there, moved back to South Dakota for my husband. We're here, and so really trying to navigate what that public health world looks like in South Dakota, because when I moved back, it was not as, I think, robust as it probably has become over the, I was probably one of the few that had an MPH. And so I worked in physical activity, I did some of those things like that, and then I really and I worked in grant and research. And then I had an opportunity to do some work with state level folks. And the way that I could do that is to start my own business.
Yeah.
And so not on purpose, but that's what happened. And so it's been an evolution of had a great opportunity to work with a lot of different programs for the state, and then work locally and nationally over the last few years. But and then while I was doing that, decided I should go get my doctorate. And so have
Stacking them up.
I guess PhD in health sciences through University of South Dakota. Go Yotes, I guess.
That's the hat trick, right? You got all three.
Yeah. So so I finished that 4 or 5 years ago now, and so being able to use that, do some teaching, and just find ways to continue to evolve as far as public health professional, and so kind of found my niche within that, and just I guess the passion to know like the value of public health, and we're often kind of the forgotten sense, I guess, and so going to be an advocate and really promote those things, and so so that's kind of been my path and why.
Kind of like if Mother Teresa was a scientist, right?
Yeah. Maybe I don't know. I'm not Mother Teresa.
Yeah. Well, I mean, I think what I'm sensing is a continued desire to work with the community, academia.
Yep.
Is it remaining in that? Now, I want to ask you, when I think about health, when we think about health, Sioux Falls, I'm thinking emotional health, not just what I'm eating. I'm thinking about my physical activity. Talk to me about that, because here in our community, I know we're resource rich at times, depending where you live or what publication you read. How are we doing in those areas right now in Sioux Falls and the greater state of South Dakota?
Yeah, good question. So, the city of Sioux Falls does do every 3 years they do a community health needs assessment. So they do a lot of data and collect data from community and residents to understand what are their health issues.
Yeah.
So that'd be a good resource to look at. I think their recent one did highlight mental health, and I think we're obviously seeing that statewide as well.
Yeah.
Certainly a lot of things before the pandemic, and it's evolved even more now. And I think we're seeing a lot of that within our youth as well too. And so that's definitely an area that there's been an elevated focus on.
We actually knew each other. We're introduced to each other a long time ago. It's a small state, so South Dakota is one of those places. If you throw a rock, you're going to hit somebody that you know.
Yes.
I'm really curious more about your work and your day to day. As you think about communities and people's health, what are the top maybe 3 or 4 things that communities should be thinking about if they want to, ensure that their population is as healthy as they possibly can be? Like, is there infrastructure things that we can be thinking about, or programs that we should think about?
Sure. Yeah, no, that's a good question. Infrastructure, I think, is a lot of it. When we look at like public health infrastructure, their communities are supported by health departments, local health departments, federal things, federal funding and sources that way. But communities, I think what we've seen the most valuable is to have that community input and community champions that are supporting that work. And so when we look at infrastructure, yeah, we need the infrastructure there to be able to provide the services that they would traditionally maybe get, immunizations, heart, blood pressure screenings, all those types of things that are important for them. And part of that takes engagement of your policymakers, your decision makers, to be able to support those types of programs and services with that. So I think we're seeing more need to focus on the resilience of a community, which means building up your infrastructure. The other thing I think is just getting the right people at the table to have those conversations. And we always say, bring them to the table. Sometimes we have to go to their table, depending on who it is, but we want to make sure we're engaging everybody who lives in a community, make sure everybody has an opportunity for health. And so having engagement of folks, I think, is a really important way to kind of keep that momentum going, and hopefully can see some ways to help that community live. And then I think the other piece of it is just a lot of that ongoing awareness building, education of community members to understand what are ways that they can be healthy, or is it access to resources? Is it, themselves getting healthier and that type of thing? But because again, we generally see a lot of that challenge in the, we call the social determinants of health, or issues that, conditions that impact how we live, learn, work, play, worship. And so if we can address kind of those root causes of things, we have some better opportunity, I think, for that. And especially in a state like South Dakota, or even in Sioux Falls, is if we can help people live and age in their community, right? We see a lot of rural communities dwindling. And so how do we help people age in their community? And a lot of that is access to resources, access to the people they need to be healthy, and help them to thrive.
I love what you said about going to them. There was a project I remember hearing about where maybe there's different populations that are not inclined to go to the doctor or to get help, and for good reason, right? For many good reasons. And so there was a project I'd heard about where they would take blood pressure at the barbershop. So there would be blood pressure cuffs at the barbershop. So is there anything like that happening around here? Are there any initiatives that you're aware of where people are actively going to the population, and if that's been effective?
I'm not as familiar with some of the stuff in Sioux Falls. I know they've had in the past, they had, I think, called the Big Squeeze. So they went around, and I'm not sure what locations they went to, but really trying to promote community awareness around blood pressure screenings. And so I'm not sure where they're at with that at the moment. But I think any of the state-based programs that are in communities across the state, and they do provide direct service, they try to go to the communities where they can. Now, there is services like where people can come, for example, WIC, there's WIC offices, those types of things. But we do know some of those programs also go into those communities to, for example, immunize, or, so we know that we have a higher chance of people getting immunized if you can maybe go to an event that they would normally be attending, those types of things. And so, not having specifics for you, I can just say that, those are types of examples that I think they do know they get a better response and better engagement from folks.
Sure.
And when we look at public health, again, in general, we're looking at multi-sector collaboration. We know you need to have the people who are impacted by the issues. And a lot of times they don't want to come to your table. You need to find ways to be comfortable to go visit with them and engage them. And you're going to have a better chance of getting some success in your programming and resources and that type of thing.
So as you think about any potential threats to public health, could you name maybe the biggest threat to public health that you see on the horizon today?
Yeah, I mean, public health is a ever-changing landscape. Traditionally we've seen impacts with funding, challenges with amount of funding, ways to work on those systemic issues. Certainly, in the current landscape that we're in, we know there's a lot of challenges with the changes at the federal level with funding and potential closure to programs that would have traditionally supported our public health infrastructure in our state, even here in South Dakota, and our community here in Sioux Falls. And so that's really a major threat right now that could really provide challenges to really effectively supporting healthy communities and having people opportunity to be healthy. So access to food, food insecurity is a challenge. So access to food, access to immunizations, a lot of those things that people traditionally would maybe rely on that they don't realize is public health, but it's really would be threatened as some of those things go away. And we're seeing some challenges with funding and government programs that could traditionally help that. So that's definitely a major threat. But ongoing, we do, not my area of expertise, but we see, there's ongoing opportunities to explore other infectious diseases. We see chronic disease is the #1 killer across the nation, and so that's really, I think, always takes a little bit of a backseat, and that's an area I've worked in for many years that really would value with more attention paid to it. Heart disease and cancer, #1 killers, and so we know those are things that we really need to focus on, and those are really developed through a lot of different those factors we talked about. So those root causes and individual behaviors, and so I would say that's probably one of the biggest areas that needs to be elevated, and it has been needed to over the years. And so those are kind of the things that I see in my work, and there's certainly many more that I'm not thinking about, but it's public health is there's a lot of different phrases out there, but one of the things is public health saved your life today and you didn't know it. Because a lot of things that we do for you don't realize are public health, but they're helping to save your life.
Like what? What would be an example?
Car seat, seatbelts.
Oh, sure. Yeah.
That was a public health achievement. Smoking reduction now, the policies, that's a public health achievement. Trying to think of another one. Fluoridation in the water, which provides some challenges right now too. So there's I should be able to roll these off the tip of my tongue, but those are some of the ones that, you guys, the society uses these and they don't know they're saving their life.
I remember driving to, I grew up in Illinois, but I remember driving to South Dakota my parents are from here. They're from West River. And we would drive back from Illinois in the back of a station wagon with sleeping bags. There was no seat belts. Like that, why would you do that? It's no fun. With, our sandwiches and Doritos and ready for the 9-hour drive. We thought it was the best thing ever.
Yeah.
So,
And then how time changes now.
Yeah, isn't that funny? We didn't think about doing that now, right? Like my 6-year-old is still in his car seat. So it's interesting how all of that changed. And you don't really think about it necessarily. It's just like all of a sudden, one day we were all wearing seatbelts.
Well, and
I'm sure it didn't happen like that. Yeah, but that's how it feels.
But the reality of and probably with your background too, but the reality of research and finding evidence, it takes time.
Yeah.
Public health is not going to give you an immediate result always. To help, for example, reduce chronic disease or get people to wear seatbelts, that probably was informed over years of research.
Sure.
Then you have to promote and educate people to hey, you need to wear these. We know it works. And so it takes time to see the impact of that stuff, but we know it does work, and there's a lot of data to back that up too. So so you probably had some messaging.
Absolutely.
Maybe.
I just wasn't paying, of course.
Probably.
Just seeping in. Yeah. Just like one day all of a sudden you couldn't smoke in a bar. Yeah. And, I do remember that because I was in my 20s, but and everybody was really, that was a big deal. But now you wouldn't think about that. Right. That seems crazy.
Right.
Sometimes given a blank whiteboard, that can be a little bit paralyzing. But with your background, I bet if you were given a whiteboard and any amount of budget you wanted, I bet that would be a dream for you.
Yeah, it can be a little daunting, but
what would you redesign first?
Redesign probably some of our structures in place as far as people who are impacted by social determinants of health. So we know, I've worked in health equity, I did research in that space, and so we know that looking at income, education, all those kind of social economic things that we know support folks to have that opportunity for health. We know those are messy, and so finding ways to, I think, put money into that or find ways to change that infrastructure a little bit. However that looks, I'm not an economist, but we know finding ways that can help people to get better access or better support people, have access to services through that lens. And I think that would be the big thing. I would really kind of focus the lens in. And then back to chronic disease. We've seen a lot of money pumped into infectious disease, and so we know there's a lot of need to look at that chronic disease lens, and so to really add money and ways to better support that infrastructure, and really from the data modernization lens to find ways to better integrate that and support that within the public health data infrastructure. And so chronic disease and those kind of social determinants of health lens is where I would stick all the money if I could.
So not to get political in any way, but there are studies that show the zip code that you live in can determine your quality of life to a degree. So tell us a little bit about tell us a little bit more about that. What does that mean? And, if I live in a zip code that maybe doesn't have a lot of support, what could I do outside of moving?
Yeah. Yep. No, but it is not. It's a reality. But there's, again, so much literature to back that up. And so basically that just means where you live determines your health outcomes. And there's a lot of research to back that up. So again, we can look at Sioux Falls as an urban, South Dakota has 2 urban areas. The rest are considered rural or frontier. We can compare that to some of our rural communities, their zip code, and see kind of look what health outcomes are in those areas. And so it does in a lot of ways determine our livelihood and our health outcomes. And so there is a lot of information to back that up. There's one called County Health Rankings. I think that might be dissolving soon, but they've done this over the years, and they have a lot of different indicators. They run all these numbers and formulas and that type of thing, but they can say this county, their health outcomes, the quality of life is this number versus like the other community. And so and they take all those things into account. And so it is reality. It's totally real. Even in Sioux Falls, you think you have a better health outcome, you compare yourself to like some of the rural areas, you'd find that Sioux Falls maybe isn't as good. And so to your question of how do we do something about it, I think goes back to kind of some initial conversations is we need investment from the community to do that. And not just the community members, but policy change. We need to look at things from funding investments, finding ways to build that infrastructure in communities to better support them. And that's the ask is from the decision makers, the government level, the city council, those types of things. So people can get involved in their community, find ways to help support and advocate for that. If they don't have the opportunity to that, and life is, you only can make it through each day, it's hard. That makes it hard. And so to be able to make a change, you can't move. And so from that lens, it's trying to hopefully find the resources of the people that can support you with the challenges that you may be having. If your zip code area does limit your access to a lot of resources. And then hopefully there's the programs and services that can go into those communities and know that. And that's part of the work of public health and even healthcare, to know like these areas are impacted or disproportionately impacted by these issues. And so we need to concerted our more effort in that area to support people. And so doesn't mean you reach everybody either. And so it's, again, there's a little bit of gaps. There are gaps in our system and our infrastructure, how to best support folks who do live in those zip codes are, make their health outcomes maybe not as good compared to the rest of the state. And so it's an ongoing challenge, I think, but it's really looking at those root causes.
Yeah. So because South Dakota is such a rural state, and we've got communities that are shrinking, and maybe their resources are starting to get less and less, where can someone go to see what resources do I have in my community? Is there a warehouse that I could check?
Yeah, I know so I know the helpline have a lot of resources. Now you have to you can go online. They have, I think you can put in by your zip code. And it can show you, or their county.
So is it helpline.com or something?
I think so.
Yeah.
So they have things. Been working on a project recently on aging resources, and Dakota at Home has resources for older populations, for resources there. So those are 2 off the top of my head. I know they can look at for resources with that. Otherwise, you look to there's a lot of people doing great work in communities, and they don't even realize they're doing public health. So some of your local nonprofits, your churches, they may have access to resources that maybe it's housing or food or just things that you need support with. And so thinking through, if somebody's trying to figure out where to find that, those are kind of some good places to start to hopefully connect the dots to where you need those services too. But there's a lot more out there that I'm not even saying, and I think that continues to be a challenge. I think we have a lot of resources, but it's finding ways to get people to know that they're available,
right,
and get people to them or bring the resources to them. And I think that continues to be some challenges with siloed efforts and people kind of not always having opportunity to work together on things. And so that's just one thought.
So trying the helpline, Dakota at Home, maybe your local churches, maybe some other nonprofits in the area, and just seeing what's available. If you're not sure where to start, could be a good place.
Even libraries. Local library.
Great.
Libraries are a wealth of information. So that might be a way to kind of get started with some information you need to.
Just so we get to know you a little bit, do you have any hobbies? Or are you like a great ice skater or something? Do you have anything that you can
Tried that
share
last
with us?
summer, last year, then it goes well.
It's hard. Like
yeah.
The skates are not easy.
Hobbies. Again, love to be outside. Love to
Yeah.
nature. I grew up in the Black Hills, so I love nature and outdoors. And travel. My husband and I like to travel. So those are kind of the two big things. And my hobby is work, so that's not a good thing to say either.
That's not a good thing to say. Not very healthy, Sandra.
No, I know. But
where are your favorite places that you've been? Like, do you have a top 3?
Let's see, Spain. It's pretty cool.
Okay.
Costa Rica. It's pretty cool.
Good coffee, I hear.
Yeah, it's been a while. So
giant insects.
I can't remember, but yes, monkeys. Lot of monkeys. But yeah, so my husband and I love to travel, and then we have our dog. But that's kind of our outdoor and being active, and then traveling is kind of what we like to do, what I like to do. So and then get together with friends. But
perfect.
Yeah.
Well, we really appreciate you being here on Spotlight Sioux Falls. If you're working in public health, or if you're working on some specific research or projects, or it sounds like if you need a facilitator, those are all things that Sandra can help you with.
Thanks for having me.
Yeah, absolutely.
So that wasn't so bad, right?
Yeah, not bad.
You're kind of amazed me. Like, you have a lot of degrees and numbers. You're pretty fancy. Like, qualitative and quantitative data, though, as we wrap up here, like, for everybody, like, help define that, because I think that would really, for those of you who maybe are like me and you need a little reminder, what does it mean?
Yeah, quantitative is just numbers, tells you what, and the qualitative tells you why.
Yeah.
Gives you some experiences on things. So.
That's it. It's that easy. You're awesome. Thank you so much for stopping by.
Yeah, appreciate it. Thanks.
This episode of Spotlight Sioux Falls is sponsored by Magnetic. We help businesses grow through content that stands out and software that scales your conversations. Not sure how to build your pipeline? You can find us at magnetic.services. Magnetic.services. Your pipeline will thank you.
Thanks for listening to Spotlight Sioux Falls.
These are the stories and the businesses that shape our city. If you heard something today that made you smile, made you think, or maybe reminded you of someone you know in your neighborhood, please share it.
That's how we support local. That's how we grow. And if you know a business owner we should feature, or you want to tell your story, reach out.
Until next time, we're Steve and Melissa, and this is Spotlight Sioux Falls, where local stories get the stage they deserve. Steve, I don't think that snack fridge is for you.
What?
We're supposed to be filming.
They have so much food here, and they have coffee and water.
I know, it's pretty great.
You're right. We should probably get to